Hi, I'm Carly Titmus, part of the Public Health Skills Development team. So one of the trainers that delivers the Assist course. Um, just a little bit really around sort of breaking down stigma and supporting people. Um, I've supported a few people. I've done a full intervention and effectively talked somebody down who's a stranger. But friends and family I've spoken to about suicide about 5 or 6 times. Um, Growing up, I thought it was really, really rare. And obviously, the last few years delivering this training, recognising that suicidal thoughts in particular are quite common. Um, so, example wise, I had a family member, middle-aged male, who had come out of a relationship and just changing little bits of their behaviour. And they live 300 miles away. I hadn't done anything by text before, but I knew it was just about sort of opening that door. So I asked him how he was, and he said, doing okay, but just feeling really, really low. For me, there was no sort of beating around the bush there. I just went straight in with really, really low, as in suicide low. And he replied yes, and that for me was a massive eye-opener, that actually people will talk to you. If you can break down the stigma, if we can use the word suicide, and if the opportunity arises and there's a chance there. He did then say that he wasn't going to do anything because of family and other sort of personal reasons, and I was able to then offer him some of the support services that are in circulation in the country. I then was able to check in with him and sort of support him in the background really. But I'd opened the door and he then knew that I was available to talk about that if it cropped up again. So he's come through that, he's doing fine. But that gave me the confidence to ask anybody where you just have that hunch. And that's what I think maybe maybe other people that I know have avoided in the past. And that's where the risk lies. And it's about getting that message out there. I've had the same experience with a friend up country, very, very similar, had suicidal thoughts, particularly when he's alone and drinking, ticking a few of the boxes, feeling a little bit down, but obviously heightening that risk with the alcohol, but saying, I haven't got a plan, I don't want to do anything. Again, I've been able to support merely by text, and just sort of checking in and offering some of those lifelines and those support services. It'd be great if we could spread that message, if more people, when they were supporting friends and family and neighbours, just saying, how are you, were able to say, are there any suicidal thoughts? That I think that would make a huge difference. And to break down the stigma around having support plans, so when somebody is feeling well and they're able to focus and jot down some of those important things that mean life to them, then feeling that that is okay and that we can have those there as backup should we hit hard times. So it's been a real eye-opener. Never gets any easier, but I certainly wouldn't change sort of those techniques that I've been using.